Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, PA. This is going to be our last and final week talking about the feet. So last week we talked about proper footwear, orthotics, the orthotics we sell, and what we can do to help. This week we're going to talk about something similar, but not quite the same. We're going to talk about heel lifts, and it might be a little hard to see the heel lift here, it's clear. But first and foremost, a heel lift is not the same as an orthotic. An orthotic goes the entire length of the shoe. The heel lift stops at the arch of the foot. Now, why does someone need a heel lift if they already have orthotics? There's a couple different reasons why patients can benefit from heel lifts. So 3 of the most common reasons why people have heel lifts are 1, leg length discrepancies, which is what I'll talk about in a minute here. 2, we have bilateral Achilles tendon pain, or even unilateral, where the Achilles tendon's real tight. Sometimes patients benefit from heel lifts there. And the last one is flat feet. Flat feet, again, we've talked about in the past. It can be physiological, it could be congenital, or it can be from a trauma. A lot of the cases, a lot of people with neurological conditions such as cerebral palsy have flat feet. Not everybody, but that just seems to be a common thing. So let's describe the heel lift a little bit. First and foremost, heel lifts can look very, very different compared to this one. First off, this is a really small one, and we have other ones that are real large. This is just the one I grabbed because we don't have any of the other large ones in stock. They can be made of foam, they can be made of cork, they can be made of silicone, they can be made of plastic. So how does a heel lift work? You know, there's different sizes. And a heel lift, some patients may need only a couple millimeters put in, some people only need a couple centimeters put in. It just depends. Now, these heel lifts here, you actually can take these apart. If you see there's little strips right here, you can actually peel them apart to the patient's positioning and liking. I'm not going to pull them off because once they pull off, they can't get put back together, so I'm going to leave it alone. But what the heel lift is doing is it's lifting the heel up, taking pressure off of the foot, and elevating the hip to its equilibrium. So whenever someone has like a leg length discrepancy, the hip and the pelvis aren't going to be in alignment on both sides equally. So that's what a heel lift will help with. So I talked a little bit about a leg length discrepancy. So what is that? A leg length discrepancy can either be physiological or it can be congenital, or more commonly people in like car accidents, they can have it from a traumatic experience, they break their femur or something like that. But what a leg length discrepancy is when one leg is shorter than the other. So my hand that's higher here, that's the short leg, and this one's the more balanced out leg. This is what a typical leg length can look like. If you ever notice, if you're a patient here, if you've ever been to another chiropractor, you'll notice that a chiropractor will take a look at the patient's feet, and they'll look and see what the leg length discrepancy is. If one side's shorter than the other, which in most cases they are, that tells that the pelvis is rocked up higher on one side. Now, usually a series of adjustments will help equal that out, but some patients have a leg length discrepancy that's too long, that even just doing a regular series of adjustments won't balance that out. So sometimes patients will benefit from that heel lift. And then there's also a couple different types of heel lifts. That there's built-in ones, and there's ones that can be removable. These are removable. You can put these in all your shoes. Where built-in ones are kind of underneath the material, and they're pretty much fixed in there. So how does a heel lift determine? How do you determine what kind of a heel lift you need, or if you even need one? Best thing is x-rays. Chiropractors, including our office, do something called an x-ray analysis. The x-ray analysis will tell us the angle of how high the hip is on one side, how much the leg length discrepancy is, which will determine then what size we need to use and how much we need to change this specific heel lift here. The other thing that's important is getting adjusted. So some people don't always need the heel lift. A lot of people say, my hip's higher on one side. Sometimes you don't need it. Are they comfortable? They're uncomfortable in the beginning. I have worn them in the past. About a week or two, it's as if nothing's ever changed. But they do work very well for our practice. Patients do respond well. Again, not every patient needs it, but if we see when we take an x-ray on a patient, the hip's really high here and really low here, no adjustments or leveling it out, yeah, heel lift would be an appropriate response for that. But that's all I have for you guys this week. A lot of chiropractors do heel lifts. They're not as popular as they were back in the 60s and 70s, but we do them here because we do find them very important. And if we think someone needs it, we will definitely recommend it to them. So if you have any questions about heel lifts, feel free to reach out. Otherwise, I'm finally done talking about the feet. We're going to move on to the upper extremity. We're going to talk about the shoulder next week, and then we'll kind of work down the arms all the way down the fingers, and then we'll go into some more complex cases in the next several weeks. So if you have any questions, feel free to reach out to us. Otherwise, stay dry out there. It's been raining all week, and it looks like more rain's headed our way. So everybody have a good week. Thanks.